So I'm going to talk about this leadership and organizational change for implementation. Full disclosure, by training, I'm a clinical and organizational psychologist. So implementation science has been a great opportunity for me to combine those. But the importance of leadership has been talked about by many people, but there are few really researching leadership. And we're interested in applying good models to address implementation because a large proportion of implementation efforts fail, more than 50%. And when EBPs are still used, but they're not used optimally, you don't get the best patient care. So we're framing this within the EPIS framework, but tailoring the framework to really focus on the inner organizational context and thinking about the preparation, implementation, and sustainment phases as we go. The loci intervention, you see I had to put the phonetics in there because it's called, people go loci, loci, whatever. We call it loci. Focuses on leader development at the first level in contrast to most leader development, which is really at the executive level. And what we want to do is align what's going on in organizations between executives, supervisors, clinical supervisors, and counselors or providers who are actually delivering services and care. And we do have a multi-level model that we're testing. The idea is that the loci strategy addresses both organizational strategy from executive management as well as unit or program level leadership to affect climate and then downstream counselor behavior in using their practice. So loci involves a number of components, including leader training. There's all participating leaders get some sort of training. All counselors are being trained in the clinical intervention, which in this case is motivational interviewing. So we use a data-driven approach with web-based surveys. We do in-person training followed up by ongoing coaching. We use also organizational strategy to link and be congruent with what's going on with our leadership training and the staff. In the control condition, we have just a webinar training for the leaders and also training in MI for everyone as well. But it's all measurement based as well. The process takes about 12 months, including 5 assessments over time, so we can use PDSA cycles to track progress and inform what we're doing in the intervention, but also with the ongoing coaching and everything we're doing. The study design is a cluster randomized trial where we're randomizing 60 substance abuse treatment programs to either the loci or webinar condition, doing that in 3 cohorts. And I'm going to talk a little bit about the first cohort and just tell you just some preliminary results. So in this we have substance use treatment counselors, 20 sites, 10 loci and 10 control, 3 assessments, and doing web surveys of organizational issues using Qualtrics. And these are some of the measures I'm going to talk about today. Implementation leadership, one of our scales, our implementation climate scale, and the implementation climate measure from Brian Weiner and his colleagues, all pragmatic measures, brief, high utility, low burden. What we're finding in this first cohort is based on the loci versus control, the blue is loci, changes in proactive implementation leadership, perceived change in the climate, the focus on the evidence-based practice motivational interviewing in those teams, as well as the degree to which staff feel that MI is supported in their organization. And it's important to note that what we're really trying to do with the leadership and organizational change intervention is develop this climate that really promotes the use of an evidence-based practice within the organization. So when we think about expected, supported, and rewarded as some of the main dimensions of implementation climate, we're finding those in our preliminary study. And there have been adaptations now of loci that I alluded to. Lauren Berkman-Frazee and Anna Lau have modified it to be used in the school settings, and we're working with the country of Norway, with all of the health trusts in the country, to roll out trauma treatments in the adult and child systems using loci in a step wedge design. So we're adapting for different contexts as well. And those are just a few references. Are we going to share these slides? Yeah, so some references will be on there. And it's my 5 minutes of fame. Thanks.
Thank you so much. Again, we have time for one question. We have one here.
This is a lot harder to do than it is to watch, I'll tell you. Jesse.
Very busy professionals potentially that are working in a lot of these organizations. Yep. What have you found so far in terms of the quality or depth that you can get with a quantitative Qualtrics type survey versus a qualitative structured interview? Qualitative structured interview.
So we're doing both, and we have we have some triangulation for convergence, looking at kind of similar outcomes, but we also want to know about some of the larger issues. So, we had the EPIS framework out there, and I said we're focusing on the organizational context. One of the things that has been evident to us, but is also reinforced with the qualitative findings, is the impact of a large policy shift in the alcohol and drug system statewide, called the organized delivery system, that involves change in Medicaid billing, as well as a new electronic health record, and demands for using evidence-based practices. But there's a real split between that policy level demand and then what is asked for in terms of documentation of the use of practices. So we're actually looking at not only change in the organizational context and leader behavior and climate, but we're also looking at the fidelity with which MI is being delivered in this case. And also looking then at the documentation. And there's a big shift in terms of understanding the quality. And that's one of the things that's really coming up in our qualitative piece. The practicality of the web surveys is, it's pretty easy. We try to minimize. We're using, as I mentioned, pragmatic measures. So our leadership measure, for example, is 4 dimensions of implementation leadership. It's 12 items, so it can be done relatively quickly. So we're trying to, minimize that burden as we roll out.
Great, thank you very much.
Okay.